Hi there, I'm Nurse Mo, and I'm so glad that you're here with me today. Most likely, you're here because you're a brand new nursing student and you have questions about everything. And one of those questions you may be asking yourself is about clinical and what that's like as a new student, especially if you don't have any healthcare experience. So, let's dive into that. Before we do, though, I want to draw your attention below this video. There is a link to a checklist, and it is called the New Nursing Student Checklist. And I want you to grab that so that you can start going through the items on that list so that when school starts, you're ready for anything. Okay, so that link is below this video. So, what's it like going to clinical as a new nursing student, even a nursing student with no healthcare experience? You've never worked as a tech or a CNA or a patient transporter or anything. Can you still thrive? Students always want to know that. First of all, 100% yes, you can. I went into nursing school with absolutely no healthcare experience. The first day that I walked into clinical was the very first time I'd ever been in any kind of a care provider role. And I did just fine. And you absolutely will too. It's a very exciting time, especially if you are really hungry to learn and love being in a dynamic environment, then clinical will be really fun for you. Everything is new. And with that, it can be a little bit daunting because everything is new. You might not know a lot of medical terminology yet. There's a huge learning curve with that. Even doing things like I remember when I was, I don't know, it might have been my first week of clinical. It was early. It was early on and it was dark because I started in the winter. So it was still really dark in the morning when we got there. And I had to take my vital signs on my patients. And I didn't know how to work because it was like in this little machine, this little contraption. And we didn't have that contraption in the skills lab. And I didn't know how to use the contraption. And I remember fumbling with it for probably 20 minutes just to figure out how it worked. So learning curves absolutely everywhere. Just being in a hospital room in that role is going to be new to you. The supply room, talk about new and overwhelming. Every single thing in there is in a white package. I don't know why. If you ever invent something for medical use, please put it in a colored package and then it will be immediately identifiable by anyone who walks in the room. The nurses station, how to navigate working with all of those people, all of it can be very new and very overwhelming. Even learning very basic tasks like taking vital signs, like I said, or taking a blood pressure can feel really complicated at the very beginning. And what this does is it can cause some stress, it can cause some feelings of uncertainty. But I want you to know you're exactly where you need to be when you go into clinical that first day and you're feeling a little unsure, like you're on unsteady ground. I want you to know you're exactly where you need to be. So remember this, okay? Give yourself some grace, give yourself permission to be learning, because ing means you're actively in the process of learning. And you can't be learning if you already know everything. So it's okay to not know everything. Give yourself some grace. If you ever find yourself feeling down on yourself because you say, I feel like I don't know anything. Well, guess what? You're not really supposed to know anything yet. You're learning. And as you go through clinical, you will know more and your skills will build. But in the very beginning, if you come home from clinical and you burst into tears with your friend or your spouse or your kids and you say, I just don't know anything. Well, that was exactly how your day was supposed to go. So you did it perfectly, okay? So you might be wondering, what should you focus on? What is first semester clinical like? What are you going to be doing and learning? So in that first semester clinical, really the focus is on you being safe, learning about patient safety, learning how safety is really a part of absolutely everything that you do. It will infuse every action that you take. I always want safety to be top of mind, okay? So you'll be doing a lot of things, learning a lot of skills, always keeping the patient safe. You'll be learning how to do things like vital signs and not just take the vital signs, but interpret the vital signs. Know what actions you would do to follow up with an abnormal, say, oxygen saturation level or heart rate or blood pressure. You'll be learning basic head to toe assessment and getting hopefully a lot of practice with that. And then the other big one is medication administration. Now, of course, there's a bunch of, various hands-on skills, changing dressings, removing IVs, placing catheters, placing NG tubes, all those kinds of things. What I say to those skills is, yes, it's good to practice them. You may not get an opportunity. I never put an NG tube into a real person until I was a registered nurse, until I was licensed. The opportunity was never there. It just didn't happen while I happened to be in clinical. So I never did an NG tube until I was licensed as a nurse. I did get to place 2 Foley catheters as a nursing student, and that was 2 more than a lot of my classmates did. So anytime there is a hands-on skill that you can practice, because it's in your school's policy that you can practice this certain skill with supervision, I 100% want you to leap on that opportunity. Even if you did it yesterday, do it again. It's never the same. It's never the same when you do it again. Okay. Every body is different. Every situation is different. And when those little, I call them opportunities, but challenges present themselves, you're going to learn how to troubleshoot and think through them, because there's going to come a time in the not too distant future when it's just going to be you by yourself doing this thing, and you got to be able to figure things out and solve problems. So get as much of that as you can. But if you don't get a lot of it, don't feel too bad, because there really are pretty few and far between. I also want you to realize that nobody expects for you as a first semester nursing student to solve all of the world's problems or solve all of your patients' problems. You don't have the background to get anywhere near doing that yet. So if you're feeling a lot of weight on your shoulders, you can kind of let that go. Now, yes, you do need to be able to function safely. And the other key thing is recognize when you are in trouble or the patient is in trouble so that you can get help, okay? You're not going to have to solve the problem, but get the help when it's appropriate, okay? I want you to always be very professional and dependable. That's what your instructors are looking at. They're looking at, your ability to follow through on things. If you say that you're going to get a blood sugar, and yes, at a lot of schools, you will be taking blood sugar measurements on patients, you have to take that blood sugar and circle back and report it to the person that you told, hey, I'm going to go get a blood sugar on Mr. Johnson in room 18. Okay, you have to be professional and you have to be dependable. You have to be someone that they can rely on. Your clinical instructor is going to make note of that. So that will be a skill that you'll be working on. For example, if a nurse delegates a task to you, and it's a task that you can do independently, and you'll have a very clear idea of what those tasks are, because you'll basically have a list from the school, and you accept that task, you have to circle back to the person who delegated it to you once that task is completed. Especially, let's say you have vital signs to report, or a blood sugar to report, or how much of the meal Mr. Johnson ate. Whatever that is, you want to be able to have that professional, reliable demeanor where you circle back to that person. And then if anything unexpected happens, it's expected that you will report that to someone immediately, because that's the RN's job to then go in and assess the patient and troubleshoot and figure things out. You will be building on your tasks every week. So in the very beginning, you'll be starting out very basic. I was a little bit bored, to be honest, my first couple of clinical shifts, because we didn't have a lot of skills yet. So we were limited in what we could do. So, filling up the time as much as you can with the things you can do. And then how do you, get a full clinical day when really all you're doing is vital signs and I's and O's and helping with meals, right? So get in there and do vital signs. Maybe you go and you do them on all the patients on the unit. That would take you a little bit, right? And then reporting them to the nurses, helping with ADLs, doing assessments wherever you can, like just cramming as much as you possibly can into each clinical day. And then as you go, you're going to learn more skills, and then you'll have more responsibilities and more tasks that you're doing. And then by the time you get to the end of your first semester, you're going to feel like you're juggling the full RN responsibility. You're not. You're nowhere near that. It's going to feel like it, and that's fine. But it feels pretty cool to be doing that much stuff for your patients. So just know that even if it starts out kind of slow, I want you to take advantage of every hour, do as much as you can, and then every week it's going to be building, building, and building. Okay. And I always want you to be ready. So a good clinical student is ready for clinical, and that means a lot of things. Okay. So that means have the supplies that you need on your person. So have your stethoscope, have your hemostats, your utility scissors, your brain sheet, your pens, like have the stuff that you need on your person so that you can use the things that you need. And just, being prepared is really, really key. Nurses are very busy. You're not going to always have time to stop what you're doing to go get, your stethoscope or whatever. Just keep those things on your person so that you're ready for anything. Another key tip is to know what types of patients are on that particular unit and the disease conditions or the surgical procedures that those patients undergo. Have a general idea. Maybe do a little reading ahead of time on those conditions. A lot of schools may have you do clinical prep work prior to clinical, where you have a specific patient with these meds, these interventions, these procedures, this diagnosis, and you write up a whole care plan before clinical. Other programs, you might show up for clinical just completely cold and not know anything about your patient yet, and then write up your care plan after the fact. When you're showing up on a unit cold and not knowing what kind of patient you're going to get for the day, really helpful if you know the general idea of what types of patients you'll see on this unit. So do your homework there. Also with that, get an idea of the types of meds that you'll see on that unit as well. Let's say it's an ortho unit, ortho surgical unit. I want you to be learning your pain medications, your opioid pain medications, your non-opioid pain medications, the reversal agents for those. Stool softeners are going to come into play, maybe some antibiotics, things like that. So know what kind of meds are likely to be used on the unit that you're on. A good first semester nursing student also does not make any assumptions. Just don't ever assume anything. If you don't know something, it's 1,000% better to say, I don't know, but I know how to go find out, or I know who to go ask, than to bluff your way through something, okay? Because again, the stakes are very, very high. And then another thing, I know nursing students, especially in the very beginning, when it's just so exciting, you guys. But remember, patients are people. They're not cases. They're not clinical skills to acquire. They're people, and they are in the hospital and most likely scared and nervous or anxious about whatever is going on. And I know, it's super cool to watch a procedure. Keep your excitement about the procedure inside, okay? You can be freaking out, excited inside that you get to watch a chest tube being placed at the bedside. But I guarantee you the person who's undergoing that procedure is terrified. So you need to keep that professional, calm demeanor. You can talk about it in post-conference with your clinical instructor about how cool and interesting it was. But remember, the person in the bed, okay? Just remember who they are and what they are going through. Again, professional, and you will get really good at your poker face. Like, I feel like I could win a world championship poker tournament if I knew anything about poker, but I would have this part down solid. Any nurse would have this part down solid. It's really nice practice to thank your nurses that you're working with, thank your patients that you're working with. They are basically letting a student do their assessments and some of their care. Make sure you're showing the proper appreciation and thanking those people. And if someone gives you feedback, what do you say? Thank you. You say thank you. You don't say, yeah, but, or start to argue or start to get defensive, because usually feedback is going to be constructive, right? So just say thank you. If you get complimentary feedback, say thank you. Don't brush it off, say, oh, it was nothing. You say thank you. Okay, that's really good professional behavior. Thank you is a full sentence, I promise. And then if you can't do skills, look again, a lot of those skills are going to be very few and far between, depending on the type of unit you're on, the day that you're there. It's really just up to chance what you're going to be able to see on a real person. So you can always practice assessing patients. when you graduate, you might feel like, I didn't get enough chance to do these hands-on skills. I felt like that. I got hundreds of clinical hours. Yeah, I still felt deficient in hands-on skills. And then, with the COVID, a lot of times clinical hours are reduced. So students graduating now are getting even less hands-on skills. So don't worry so much about that, because I promise you, if you're a new licensed nurse and I'm your preceptor and I know that you didn't get a lot of opportunities, I'm actually going to assume you got no opportunities. I'm going to show you one. I'm going to have you do one, and then I'm going to have you teach one to someone else. You can learn how to do those hands-on skills. I could teach you how to place a Foley catheter in probably 10 minutes, maybe less, okay? But it's the assessment skills, your clinical judgment, your critical thinking, your ability to recognize if your patient is in trouble, your ability to connect the dots with pathophysiology and the treatments and the outcomes that you expect, and noticing when something's not what you expect and realizing, oh, I got to do something about that. That is what makes you a nurse, okay? Not all this hands-on stuff. I could teach you that. Seriously, 5 minutes, we're done, you're good to go. Focus more on the assessments, the clinical judgment, recognizing the cues that your patient is improving or not, and what you expect them to do based off the interventions, medications, procedures, and whatnot that you have done. Okay, that is huge. And one of the ways that you can fast track that clinical decision-making, that clinical knowledge, is by keeping a clinical journal. So as you go home from clinical, write down, what did you see? Was there a situation where the patient had a change in condition? What questions came up for you around that? What did you notice the other team members doing and assessing? What did the MD order? What did the nurse do? How did the patient respond to that? Write these things out, and then later, when you have a patient with somewhat or the exact same issue or even a closely related issue, you can now draw on that bit of knowledge to help you apply clinical decision-making to this situation. That is 100% how you develop your clinical judgment, your ability to act in as a bedside nurse when you're responding to things. So keep a clinical journal, okay? And then the other thing I would say before I close out is have fun and enjoy the process of learning, okay? Remember, learning. It's a process. You're going to encounter people who are burned out, people who are cranky, people who are negative, people who are down on the profession. It's okay. What you're going to learn pretty quickly, especially when you're working as a nurse, is someone else's experience does not have to be your experience. So, for example, if I get report on a patient and all I hear about from the offgoing nurse is how bad that experience was with that patient, I hold off on thinking, I'm going to have a bad day with this patient now. I guarantee you, most of the time, if you go in with an open mind about anything, a patient, the career, your clinical days, go in with an open mind. Don't let other people's experiences sway you. Most of the time, you're going to have a good experience. And if you don't, it's because you had a difficult experience, not because of what somebody else said, okay? So don't let other people's expectations about themselves or their experiences become what you think is going to be yours, okay? So that'll definitely come into play a lot. You'll see that in clinical. You'll see it even more when you're out there working. But if you come across someone who's burned out and over it, don't assume that you are going to have that same experience, okay? I want you to have fun and enjoy the process. It's going to be great. Okay, thanks for watching. And again, that link to that new nursing student checklist is below this video. Grab that and you will be ready for anything.